Test 1 2 3 1 2 3. Test 1 2 3 1 2 3.
So I could fit it in so people can watch the videos. Just go on here. I made it shorter. Let's see. So I cut some stuff out so I could make sure I get all the videos played. I suppose it is right now. My name is Carolyn Sachs, and I want to thank you and your medical system for including this lecture. It's a very important topic, and I want to thank these nice folks here for sitting in the front. I think they're empowered to sit in the front because they know I'm not allowed to walk away from this podium. I've been instructed that I have to stand here. And I also feel I have to apologize for not having an accent, since everyone I've met has an accent, and I love your accent, but I can't fake it. That would be really awful, so I apologize for that. But I really do like your accent. It's very welcoming. I do, you're right. That's right. Does it sound cool, though? You know, like when you hear someone from England, that accent sounds cool, but I'm guessing that mine doesn't, so. So I'll just leave it at that. I'll go ahead and get started. If you have any questions, I'll try and take them during the course of the lecture or comments, because those are often very helpful. I think I hit the button. Did I hit it? Are you able to make it go backward or no? Well, it doesn't really matter. We're fine. We're fine. But I do have some pretty interesting videos that I would like to play. So if the time looks like it's going to be a crunch to get under an hour, then I will try and answer and talk, share information and ideas and answer questions afterwards. So we'll try and get it started during it. So this is basically the outline of what we're going to talk about in terms of what you can expect. And what is my goal? What is my goal for you in this lecture? Now, you can have your own goals, and that's fine. You may have attend many lectures. How many lectures have you attended in your lifetime? Probably. Anyone attend at least 100 lectures in their lifetime? So exactly, right? So do you remember? Do you have a goal from each elective? Do you have, from each lecture? Is there something you remember? Probably not. There's probably a few that stand out. But I have a goal for this lecture. And that's to give you one takeaway point, so that when you go to bed tonight, or if you have any sort of ritual of gratefulness at the end of the day, or maybe you're eating dinner and you say, is there one thing I could have gotten from that lecture? And if not, you can go ahead and send me an angry email. But otherwise, I hope there's one thing you can think of that this lecture did that will give you a field goal, or give you my goal, is that you can take it away and either implement it in your life or give it to a colleague or a friend in need or a relative in need that will improve that person's well-being or your well-being. Just one. And I want to also refer you to this online free resource from the AMA, the American Medical Association. You don't have to be a physician. You don't have to belong to the AMA. You don't have to be anything. It says open access. Many modules on time management as it relates to wellness and practice and improving practice. And it is really just phenomenal. You can get CME and CEUs for it, for doing it, for completing this. And you don't have to do that, of course. You can just take the information that you need. So any gaps in this lecture can be filled in by going to that resource, American Medical Association. So what is burnout? And why do we care about it as far as time management goes? Anyone know who this woman is here? This woman, her name is Christina Maslach, and she invented the Maslach Burnout Inventory, or I will call the MBI. And this is what we all use in medicine and many other fields to measure our level of workplace burnout. And in defining it, there's 3 components of burnout. The first, and in general, people go through these stages when they become burned out at work. Emotional exhaustion, so which means is that you can't recover. Time away, you go to the beautiful hills here in Alabama that we just drove through, and you're still not recovering. You're still emotionally exhausted, even when you leave work. And the next stage is depersonalization. So you may see this in a colleague. You may see it in yourself. I actually see it in myself sometimes. Where I am blaming the patient for being there. Like, if this patient wasn't here, I could see the next patient who's more important, that type of thing. Like if they weren't complaining about this little problem that they're here seeing me for. I'm an emergency physician, by the way, and that will come into play also through the course of this 1 hour we spend together. Any other emergency physicians or anyone working in the emergency department? Great, okay, thanks. Chime in if you have anything to add. And we'll sort of query you about where various ones of you work throughout the course also of this hour. So cynicism, and I definitely see that in my colleagues as well. And then reduced accomplishment. I'm a bad doctor, nurse, physical therapist, PharmD, allied health professional. And that one is less often measured because it doesn't correlate as much with the other two and with what we think is burnout. So in terms of depersonalization, I like this cartoon. This sort of gets at, I mean, I think you'll recognize this in your colleagues, if not in yourself, is when they come with a complaint. You know, I wear body fluids that aren't mine. I work weekends and holidays. I get screamed at. I have my hands in other people's orifices. Tell me again how hard you work, right? So I often get that. And you may feel that way when you talk to many of your friends, too, that aren't in the medical profession, that do have every holiday off, that have every weekend off. So what about by specialty? So as I said, I'm an emergency physician. This is a study that was done in 2012 and replicated 4 years later by Tate Shanafeld, who at that time was at the Mayo Clinic. And looking at, these are people that measured high at least on one scale of the burnout scale, one of the 3 measures of burnout. And you can see that physicians in general, about 50% of them are burned out, meet the definition of burnout, which is much higher than the general population and higher than other professionals as well. Who's number 1? Who meets number 1 definition? That's my specialty and your specialty, doctor back there. Emergency medicine is the number 1 specialty by far and away for burnout. You know, it's hard to read all of these, but internal medicine is next, neurology. Any neurologists in the audience? Okay. Any internal medicine in the audience? Generalists, family practitioners? So surgeons also sometimes have high levels of burnout. And then what do you think would be the best preventive medicine in terms of the least burnout? Radiology, you got it. What else? Dermatology, right? Any of those, any radiologists in the audience? Although things have been changing with radiology, I think, in recent years. So maybe the ER physician in the back can also relate to this. ER medicine is easy. It's like riding a bike, except the bike is on fire. You're on fire. Everything is on fire, and you're in hell. And it sometimes seems like that, but the good thing about that is it makes time go quickly. So in reframing things, you have to look at the bright side. So even when you feel like you're in hell, your time passes quickly, and you're living in the moment. You're not thinking about, well, I want to do this later or this later. You have no chance to do that. You're living in the moment. So that's the bright side. I don't always feel like that. I do enjoy my job most of the time. So things have, like I said, things have gotten worse since 2011 and when the study was reperformed in 2014. And this is Tate Shanafeld here. Anyone heard of Tate Shanafeld before? So he led the way on a lot of these investigations of medical workplace. He not just physicians, but other people in the medical arena in terms of workplace wellness and burnout. And he was at the Mayo Clinic, and he has since moved to Stanford, and he is the first ever chief wellness officer of a medical center in the United States. And so hopefully other medical centers will follow suit. But that shows you how much that medical center, Stanford, is invested in the wellness of its employees. They have a paid executive chief medical officer now, and that is this physician here. And so this just shows you, like, as I mentioned before, over half of US physicians report at least one symptom of burnout on the burnout scale or meet the definition. In terms of work-life balance dissatisfaction, that also got much worse in the 3 years studied. You can see there, and we'll talk about that. Why do you think that might be? Why is there worse work-life balance satisfaction, over those 3 years? Any guess? Any of you use an electronic medical record system? Yeah? So when was that implemented in your medical center? What year? Do you remember when your electronic medical record was implemented? 2012? 13? So somewhere around then, right? So around those those years is when we had a lot of medical centers implementing the electronic medical record. Which electronic medical record do you use? Cerner, okay. I think that's what our county system uses, our Olive View County system uses. And I think there's some things better about it, but some things that they find frustrating. We use Epic at UCLA Medical Center where I am. I think they all have the same problems and challenges and maybe benefits. You may see some benefits for them. So what are the risk factors? We said too much bureaucratic text. So in terms of time management, how much of your time is spent interfacing with an electronic medical record that seems not to be designed for you to use very well? Most of the day. So that's what our physical therapists say. What does the rest of you say? Oh, it's easy? It's not, right? So I think everyone feels like you do, right? And they probably don't even realize that you say that as well, right? So you want to be on there with the patient, helping them move, helping them recover, but you have so much documentation to do about that that may be zapping the joy out of taking care of patients at some point, and actually is a waste of your time, frankly. It's a waste of your time, right? There's got to be a better way to capture what you did than spending most of your time interacting with a system that wasn't designed actually to allow you to interface with it, efficiently. So I think that probably universally is the #1 thing people say in terms of time management at the workplace, in the medical setting, that is increasing burnout. Because they can't do what they were trained to do. They are computer drones. So working with challenging patients. How many of you have had patients that have problem lists of 20? We see a lot of transplant patients at UCLA. I've seen problem lists of 50. Crazy, crazy amounts of problems, very sick patients. At least 10% of my patients have someone else's organs in them, it feels like. So, and those are very complicated patients. A loss of autonomy. So are you measured by metrics rather than how well your patient is doing given your patient's set of values? Your patient's not going to take a statin no matter what you say. And maybe in 15 years we'll find out they shouldn't have taken a statin. But now your quality is measured by whether they're on the statin or not. So that's frustrating and also can cause burnout. It's difficult to change careers. Now, it may be easier in certain areas. So if you're a nurse, you may be able to go move to another state and do a different, how many nurses in the audience? So a few of you. So it may be a little bit easier, 2 of you. You probably like your jobs. But if you didn't, you could go to, surgeries. Like many of our emergency nurses do get burned out after years. And there's a wealth of, different places they can go to within the medical center and still keep their UCLA job with its benefits, or if they're early on, they can travel around. It's not so easy if you're a physician, right, and you have a practice. It's very difficult. I'm an emergency doctor. I couldn't say, oh, I just want to be a plastic surgeon now. That's not going to work, right? I would like to be a neurologist. I'm not too bad. I didn't train for that. That's the end of that, right? I can't just do that. So difficult to change careers. Too much work without enough time, which is, I think, universal. Poor patient outcomes, and lawsuits. And we'll talk about that. Any more? Any glaring thing I left off this list that contributes to your burnout? I think. Okay. So in terms of how you spend your time at work. So the most meaningful aspect of work for most people in medical care is patient care. So 65% of people say that's the most meaningful aspect of their work. That's why they went into medicine. They didn't go into medicine to be administrators or to interface with a computer. Some people are researchers, and they say that that's the most meaningful aspect. Education, teaching is very meaningful. And 3% of people, these internal medicine doctors, felt that administration was the most, and they probably were administrators. They probably were the doctors that decided to be administrators. But it's been shown that spending less than 20% effort in your most meaningful activity is strongly associated with burnout. So in terms of time management, look at your day. If you are spending less than 20% in the most meaningful aspect, you are going to burn out. And that is how you have to look at time management. And how can we solve that? We'll try and talk about that a little bit. When we were in the very early stages of talking about physician wellness and actually paying attention to this and paying attention to burnout, we, as a medical community or as the medical infrastructure, the medical system, would say, oh, your physicians are burned out. You're not taking care of yourself. You need to exercise more. You need to meditate. You need better coping skills. Go get those so you're not burned out. And the problem with that is that a lot of burnout is a work problem. It is a loss of satisfaction and with work. And so blaming it on the individual physician, the individual physical therapist, nurse, PharmD, blaming it on them is actually abusive, because you're taking a workplace and making it much worse, much more hostile, making them do a lot more time at things that they didn't go into medicine to do. And then when they're not happy with that, saying, you're burned out, get help for yourself, right? So this is one physician wrote, one physician wrote this, that physician burnout is abuse. And that's just sort of to reel it back in and say that this is actually a workplace problem. Not that there aren't things we can't do individually, because we can. Sometimes we have a short fuse, and there's things we can do to work on our own selves as well and regenerate. And we'll talk about those. But this is not a problem of the individual. And I believe that. I don't know that it's abuse, but it is not a problem of the individual. And not only that, the medical system, if it wants us to manage our time better, needs to understand that it needs to address burnout and wellness in the employees, right? So I was asked to focus on time management in this, but I can't focus on time management without addressing the most glaring problem, which is how can we be happy and well and engaged so that we are the most productive? And that's how we manage our time better, right? So what are the consequences of not having happy, well-adjusted, engaged employees, having them be burned out? This has been demonstrated in the literature. Patient satisfaction is worse. Patients don't listen to what we say. If they don't like their doctor's sarcastic to them, they don't listen to them, they don't comply. And I'm the same way. If someone's snippy at me and they don't tell me why I should do something, I'm not gonna listen to them, right? Turnover, absenteeism. It's estimated that for every physician that leaves practice early in order to get another one to replace them, educate them, bring them up to snuff, it costs at least $250,000. So that is a big financial reason to address this topic. Detrimental attitudes will decrease our productivity. Who wants to work with a bunch of cynical people, right? And then people intend to leave medicine. So like I said, it's not easy. If I said I want to be a neurologist, I can't do that. I wanted to be a dermatologist. Oh, I made a mistake. I'm an emergency physician. I'm working in hell instead, and now I can't be a dermatologist. Well, what can I do? Well, maybe I'll just leave medicine and do something else, right? So it also leads to medical errors. So this is a safety issue as well. Physicians that are burned out are more likely to have self-reported errors over the next 3 months. It's the same thing with depression. So how many of you heard of the Triple Aim? Anyone heard of the Triple Aim? So that, a few years ago, the Institute for Medicine said, medicine, you're spending too much money, you're having all these errors, we need to have better outcomes. We can't be killing all these people with our medical errors. And it costs way too much, lower costs. We have to improve our patient care. And there was a big push for metrics, for improving our quality with metrics, right? But what did they forget in this Triple Aim? They forgot the person carrying it out, the clinician wellness. And you cannot improve a system without looking at the vector of improvement. And the vector of the improvement was the physician. Instead of supporting the physician or the clinician, they just said, you're going to do all this, and we'll take from you, we'll take from your time. So that in order to get it all done, it's going to, instead of 8 hours, it's 8 hours, you have 8 hours to do this, but it's really 27 hours of work for every day, which is impossible to accomplish, right? So this, in the last few years, has been coined the Quadruple Aim, which takes into play the fourth aim, which is clinician wellness. And this, anyone know who this is? If you look really closely, his name's on his lapel there. So, Murthy, right? This, right, Vivek Murthy, very good. Vivek Murthy was a former Surgeon General. He was named Surgeon General. He was the 19th Surgeon General of the United States, named in 2014 by President Clinton. And he was a keynote speaker at the first annual American College for Physician Wellness lecture that I attended in 2017. And he was appointed by Obama. You know, I get him confused in my mind. And he said you know, this is a safety issue, right? Obviously, this is a safety issue. Make more errors if you're burned out, you're not well. It's a quality issue. It's an issue of financial cost. He said, but even if all of those things were not true, we need to address physician and clinician wellness. Why? Because clinicians are suffering, and it's the right thing to do. And that's the takeaway quote I have from that. So what's the opposite of burnout? How do we become well? Is it happiness, wellness, balance? How do we manage our time, our own personal time, to achieve professional and personal wellness? And what do we do to feel restored? So for me, I really like purple. So you notice my slides are purple. Just seeing the color purple makes me a little happier. So anything I can do, even at work, to incorporate purple, even though I'm not wearing purple today. This is a tribute to Alabama that I'm wearing red. Even though I'm not doing that today, everything else that I like to look at, if I can make it purple, I do. And I even get people who are disappointed when I'm not wearing purple at work. But that's one little thing to incorporate within your work day in your life if you have a favorite color or a favorite shape. I also have little smiley faces that I got really cheap from China that you can put on your lapel here, and I give those out at work sometimes. And it's amazing, if you wear a smiley face on your shirt, you walk down the street and like people will be smiling at you for no reason. You'll be like, why are they smiling at me? And you'll smile back. You'll be like, well, there must be something good about me today. And then you'll remember you have that smiley face on. But so if a few more people smile at you that day and you're a little happier, it's worth it wearing those little smiley faces, right? So little tricks that you can do, you know, with sunset. And again, if you need concrete resources, this American Medical Association website gives you concrete personal resources as well as professional resources. And what about satisfaction? So if you measure how physicians feel about work-life balance and satisfaction, it's not actually the opposite of burnout. So even though I'm an emergency physician and we are at the top of burnout, we actually are sort of a little bit higher in terms of our satisfaction with work-life balance. So that may have to do with how many hours you're working, right? Because you can see down here, general surgeons and other surgeons here are not satisfied with their work-life balance. But it is true that most of the top two, the preventive medicine, the dermatology, the radiology, they got it good both ways. So more recently, there's been a meta-analysis looking at all randomized controlled trials as well as well-done cohort interventional trials, looking at interventions to improve wellness and decrease burnout. And what they found after looking at all of these is that there is a benefit to these interventions. So they take resources, they take time, they sometimes take funds. There's a benefit to them, though. But this sort of leads back to the point about where is the root of burnout. The conclusions of this support the view that burnout is a problem of the whole healthcare organization rather than individuals, and that the interventions designed to boost wellness and decrease burnout within the organization rather than aimed at individuals were more effective. So what are those types of things? So those things are, these are hard to read, but instead of having the practitioner, the clinician, the person that is trained to be hands-on to help with the patient, entering all the information into the computer, you have the medical assistant enter it. And there's a medical assistant physician or medical physician physical therapist dyad. And the medical assistant's job is to put the information in the computer. And the clinician interacts with the patient. They do what they were trained to do. Mm-hmm. We in the emergency department have scribes. So they're not medical assistants. They can't touch the patient. But they are scribes, and they're usually people that are wanting to enter the medical field later on, become a physician extender or a physician, and they spend a couple years being a scribe. It is phenomenal how that changes your time management, and it helps with documenting. They can't put in orders, so some other assistants can put in orders. Better flow, and there's lots more things that are specific to what place you work at that I refer you to the steps forward from the AMA. But there's other ways to improve your time management so that physicians are doing things that they were designed and they were trained to do. Physical therapists are doing the things that they were designed to do. Nurses are doing the things that they were designed to do, rather than spending all their time at the computer. What about logging into your computer? Do you log in? How do you log in? Do you have to put your password in every time you go on the computer? Not every time? What other times, how do you do it?
Some have the badge.
Some have the badge, good, okay. Okay. Okay, so that's just an example of how things have changed in the last 2 years. We just got this badge tap and go in the last year. It's really much better, I believe, than having to sit down. Any keyboard strikes that you can eliminate saves you time, saves you frustration, right? Because I didn't always put it in. I had to change my password. You have to change your password all the time. Now we have some sort of security system where you don't have to change it, and that makes it a lot better too. Having to change it every 3 months was painful, and then when you forgot it and tried to log in again, then you were locked out. You know, just obstacles towards getting the work done that you need to get done, right? So having a full-time informaticist available there, available to help you, listening to clinicians and what their frustrations are, and then going back and changing the system, that works to decrease burnout. All right. Click. There we go. Oh, it's not on. Can I get the volume on here? Yeah.
She's coming up.
Oh, good. Thank you. Okay. So this I have to back up because it's not on now. This is not backing it up. I'm trying to back up the program.
How far back?
To where that man's face there. There we go. Thank you. I don't think it's still not working. We might have to skip it, huh? We can come back to that. Let's see, what time is it? Should I hit it again?
No, it's not working. This volume's all the way down.
Well, this physician is a plastic surgery resident at Loma Linda, and he talks about his experience with that in the last, he said, year, 2 of his colleagues committed suicide in the residency there. And he said, you know, the superiors say, well, talk about it with your superiors, talk about it with your residency program director, talk about it with so-and-so. He said, who are they kidding? We can't talk about it. If you talk about your mental illness, if you talk about the fact that you feel overworked, that you feel burned out as a surgical resident, you're weak. You're labeled as weak forever, you know. And then you have more stigma. And he said that, you know, basically a lot of things haven't changed. So things have changed for certain specialties. And I truly believe one of the reasons that we're paying more attention to wellness and physician wellness is the fact that our trainees now have regulations on them. They have workplace hour restrictions. They have requirements by the RRC that they don't violate those, that they have to be off, they have to have a certain amount of hours off. They can't work certain more hours a week. They can't work 7 days straight. They have to, you know, have a day off at least within every 7-day period. And that actually does happen. And when I was an intern, I did 3 years of surgery, 3 months of surgery during my internship, during my rotating internship. And I didn't have a day off in 90 days, 3 months. And there's probably even, you know, more grueling histories you can hear from the back of the room. So that is illegal now. You could not do that. I shouldn't say illegal. Your residency would be de-accredited. It would be in big trouble if they did that. So we say, you know, our trainees, it's inhumane you know, that they are not allowed to do that. That's inhumane. What we went through is considered inhumane. Well, maybe we should have more humane treatment for ourselves as well, for all physicians now, because this is actually mandated by the Residency Review Committee. But sometimes it doesn't filter down into actual practice, and particularly in this surgical resident's case. He didn't feel that he could admit that he had some problems or that anyone had felt burnt out. Okay. So what I want to mention is that burnout is not the same as depression, but we're all human beings. And the general prevalence of depression in the United States at lifetime depression is probably about 20%. And just because we're in medical care doesn't mean we're immune from that. 20% of us have or will be depressed, clinically depressed at some point in our lives. And we deserve to have the same treatment that we would recommend for a patient or a friend. If we saw them clinically depressed, we wouldn't say, just carry on. You're weak. You can't admit that. Right? We think it's a medical disease and it has a medical solution, possibly. In terms of being sued, how many of you, well, you're probably not going to raise your hand, but I would tell you, how many of you know, how many of you have a colleague that's been sued, right? So we all know that, right? Feelings after being sued, we have twice the divorce rate and an increased suicide rate after being sued. If you are a physician who practices till age 65, 90% chance you will be sued at some point in your lifetime. How does it feel to be sued? It sucks, right? It's awful. This is what you spent your life devoted to. You are doing the best you can to take care of that person. Now, you may, most of the time, actually, you're not responsible for the bad outcome that they had. But maybe you are. We're human. We make mistakes, right? How do you deal with that? That is a tremendous load. And the bottom line is, it's a crapshoot whether you're going to get sued or not. Most of the time, it wasn't malpractice. And I wrote a little editorial on that you could look up later on if you want. 10% of us will be 10%. This is lower than the general population in terms of drugs. In terms of alcohol, it's about the same. We have the same genes as the general population. We're predisposed to substance abuse the same rate. And people need to have help for that. Can't just ignore it, right? So is it a problem? Are physicians killing themselves? Well, in general, there's about 400 physicians a year, the equivalent to a very large medical school class, or maybe several, it's 3 of my medical school classes. I went to Northwestern in Chicago, and thus the purple. But 3 of my medical school classes, that volume kills themselves every year. We lose that many physicians to suicide. Unfortunately, there's been a sort of a rash of suicides among New York physicians. And this is documented in this blog, Kevin MD, which you may have heard about. Sometimes we don't even know. Many deaths probably aren't adequately investigated and not recorded as suicides. And medical students also have a higher rate of suicide and depression. So is this worse than the general population? So I told you about depression and I told you about substance use. What about suicide? Well, unfortunately, physicians have a much higher rate of suicide than the general population. In terms of male physicians, you can see their likelihood of dying of suicide compared to the general population is many, many times higher. Their likelihood of dying of accidents is higher. Cerebrovascular disease. So we have had several physicians that had strokes recently. But these other things are lower. Why? Because their lifestyle is, in general, pretty good. They don't smoke. They don't get HIV. They get these stress-related illnesses, and then they blame themselves for things. They blame themselves for having depression, and they don't get treatment, and then they kill themselves at a much higher rate. The suicide rate for female physicians is even higher. It's 2.3 times the general population. So female physicians and male physicians kill themselves at the same rate, which is vastly different than the general population, where men outnumber females in terms of completed suicide 4 to 1. Why are so many female physicians committing suicide? That's a good question. Huh? This woman here is a champion of discovering the reasons for physician suicide and uncovering what we can do to change that in the future. I wish I could play this video for you. It's really great. This is a woman here that talks about her father here. He was a very well-revered family practice doctor in his community in North Carolina, and shocking everybody, he killed himself. And what she says is, he was a great doctor, his patients loved him, but he was at that point in his life where he had depression. He had clinical depression, he was suffering from it, but he didn't get help. He didn't want anyone to know. She said he'd be mortified. She said, what would he do now if he knew that they actually changed the law in North Carolina so that when you get your license, they don't ask you if you've ever had a mental illness. How many of you have applied for a license and the state license board asks you, do you now or have you ever had a mental illness? So let's check this doctor right here. Why do they do that? If it doesn't impact your ability to practice, why would they ask you that? That wouldn't even stand up in court these days. And it was challenged in court in North Carolina, and they removed it. And not only do they not ask about it now for renewal, they don't even ask about it when you first get your license. There's no reason to ask about that. Many other states have removed it from their licensing agreement as well. I don't know specifically about Alabama. I know California has not. And despite the fact that we're very progressive in many things in California, this is one area where they're not progressive. They're antiquated, I believe. But it's much better in North Carolina. And so this woman says, well, how would her father feel now that his death spurred this whole change in North Carolina and that everyone's talking about it and physicians are getting help? They can get help for their depression, so they feel there's another option for them to go on and serve their patients and their families and live their lives while still having their depression treated, which isn't affecting their work. They don't feel that that's reasonable, and their board's not going to ask them about that. She said, in some ways, he'd be very gratified that his life had meaning. In other ways, he'd be incredibly ashamed that everyone knew about this because of the stigma of mental illness, right? So we need to destigmatize this so that we can all get help. Just consider a default. Any psychiatrists? Are there any psychiatrists in the audience? No? So in psychiatry residency, they have to get therapy. It's part of their residency. They have weekly or monthly therapy. That's part of it, right? Or whatever it is, treatment. So maybe there should be an opt-out. Maybe there should be one session a year scheduled for people, and they could say, look, I'm okay, I don't need it. But that year that they need it, it's already scheduled for them. It's not a barrier. Feelings after being sued. I told you what happens after you're sued. I told you what it feels like to be sued. Well, some wellness programs in some medical centers, Brown and Harvard, actually, when someone's sued, when that document comes in and they are actually in intent to sue, they reach out and say, here, I'm your partner on the wellness team, on the well-being committee. I'm on the well-being committee at UCLA, and we're trying to get this instituted. But this can be really stressful. Let's meet and have coffee, or let's meet and go on a walk. Let's talk about things. Tell me how you're feeling. They can't talk about the specifics of the case, but they can talk about their feelings. And so maybe that should be an automatic thing after a lawsuit is brought. We talked about the need for drug and alcohol treatment. If a physician or a medical provider has a drug or alcohol problem and they enter into treatment, they are very likely to be successful, much more likely to be successful than the general population. So what we need to do is, again, destigmatize it and get that help out there before something bad happens. Okay. So personal solutions. So there are things we can do to help with our personal solutions. Many of us have a hard time winding down from our careers in medicine. And we have sort of a, I have to do stuff, get things done attitude constantly. And there are personal solutions that we can take to improve our own wellness, both at work and away from work. And I talk about attitude shifts. So we talked earlier about blaming the patient. We get patients complaining because their work's so hard. Sometimes I'll have patients that will, tell me a litany of things that have happened to them that seem very horrible, but I'm back in my mind, or if I'm an emergency physician, thinking, I'm on fire, I'm in hell, I'm working in hell, and then how can they tell me about their problems? I just stop. And one of the best things I can say to them, and I have this in the scripts, is, boy, you've had a rough week, haven't you? And even if I don't feel that at the time, seeing how that makes them feel better is so rewarding. And it's their experience. If they have had that rough week. And just getting away from your own self and your own fire into putting your focus and your attitude on that patient brings you back into the moment and is tremendously rewarding. And that's why I went into medicine, to make them feel better. So even if their week sounds like great to me, their tough week sounds great to me, if I can say to them, that sounds rough. Boy, you're feeling really overworked right now. And that makes them feel better. That is great. That is a great interaction. Mindfulness is you've probably heard a lot about it. You might be wary about, there's a lot of consumerism about mindfulness now. I'll give you some resources that I feel are not trying to just make money off of you. And then time management tips for all professionals. This was a sort of a moment when I had an aha moment early in my career when I was very geared on the research track, and someone I thought about is incredibly successful, was doing really well in an academic center, decided to stop doing that and just work part-time in a community center. And this was her. To spend time with her kids, to have a more balanced life. She said it wasn't worth all the sacrifice. And I thought, wow, what am I doing? You know? And I thought I really got onto the track of talking about, sorry about that, talking about wellness and paying attention to your own personal wellness and making different choices. In terms of mindfulness, it's been coined as paying attention to the present moment without judgment. And many of you probably already have experimented with this. Other things that may help relax and calm you in your time off is yoga, tai chi, meditation. And what about during work hours? I saw on the way here that you have a fitness center on campus, is that right? So is that for employees? Awesome. Great job, St. Vincent's East. That is great. We do not have that available. I've lectured at some other places that have it available. The Mayo Clinic has it available. That's phenomenal. Do you have like meditation and yoga too sometimes? No, not yet. But that's easy to do. You can maybe incorporate that. Ask them if you're interested in it. There's many podcasts. This is a great book by a physician also at the Mayo Clinic that I truly believe has helping people at heart, not about making money. His name is Dr. Amit Sood. And these are sort of some practical tips that I gleaned from this book that help me. Sort of, the hurriedness is almost often internal. Like, so how many of you find yourself in the line at Starbucks or wherever you go for get coffee, and the person in front of you is like, well, what's in that? Probably the person in front of you is me because I'm that way, but like, what's in this? Is that non-fat, or could you have sugar-free this or that? And all you want to do is get your big grande black or whatever it is and get out of there, and you're just, oh my God, can't that person order by now? Just think about how can you be joyful in that moment? Maybe the person behind you is someone interesting to talk to. Or maybe you can just say something nice to the person in front of you and say, look, I got this, it's really great, or I hear this is good. And then it just deflects the anger that you're feeling towards that person. So feeling negativity about another person actually brings up negativity in yourself. So if you can change that so you're feeling something positive about that person, or at least neutral, you're actually helping your own well-being. And that's what I found really powerful about this book. Attitude shifts. If you can do that. If you can say, my attitude sucks right now. Can I switch it around? Sorry, I apologize for my language. You should hear the way people talk in emergency medicine, but sorry about that language. Okay. This is a website you can go to and look at his little snippets, and he has these really sort of simple answers or simple sort of methods to just improve your general wellness each day. Just think about 5 people that you love and send them kind, loving thoughts first thing in the morning. I did that for a while. I've been forgetting to do that, I have to admit. 3 minutes. Try, in the first 3 minutes you come home to see your loved one or you see somebody else, try not to improve them. Don't say to your daughter, did you have to have that, you know, whatever, did you have to mess up the sink or clean up the sink? Instead of saying that, can you say, how was your day? And wait 3 minutes before you try and do any kind of corrective actions. Just be with her in a positive way for 3 minutes. And then 2 seconds, take 2 seconds before you react. What about upset patients? So sometimes we have patients that are upset in the emergency department, believe it or not. They may have been waiting 5 or 8 hours and they're upset about that. Can you believe that? But having a preemptive discussion saves time in the long run. No, usually we're not that bad. But I always say, I start off every conversation with, I'm sorry you had to wait. It's tough. You know, even they go, oh, I only waited 5 minutes, but thank you. You know, and that's rarity, but sometimes they haven't waited too long. And overestimating the time that it's going to take is very helpful. Disneyland does that. Have a standard polite response memorized so you don't fly off the handle and get angry. So don't argue with the patient. That never works. No one wins. Even if you feel like you've won, no one's won. No one's won that. Like I said, if they seem frustrated, just label it. I can see you're frustrated. This is, like I said, told you my favorite is you've had a rough day, week, month. Sometimes you have patients that, anyone ever have a patient that complained about 5 things in one visit? Ever? You said you get one thing, that's it. That's not going to be helpful. I can see you're concerned about a lot of things. There's a lot going on in your life. Tell me, what's the most pressing concern you have today? You're on their side there. You're not going to be able to do all those things, but you're concerned about them. The regular doctor can talk to them about that. But what's the one thing that brought you in here today? You want to help them. Say, I really like to help you. I really can't order the MRI on your toe today. I can give you some topical analgesia for the toe since all the oral medicines haven't been helping you. And maybe I can recommend a much better shoe for you. Something like that. So that you're concerned about their problem. You're not necessarily going to do everything they want, but you're going to do things that you can to try and help them. So we talked about scribes, eating. You know, we're human beings, we're animals. Human beings are animals. In general, we need to eat every 4 to 6 hours, unless you're doing that new fast thing, but I don't agree with that. And I think in order to function optimally, we need to eat every 4 hours. Limiting our work days. Shift work. Anyone shift workers in here? There's a concept, so I see some nods. Yes, there's a concept of anchor sleep, so getting some part of your normal sleep. I see you're nodding your head to that. Exercise, which may be easier here, you know, because you have this gym on site, which I think is great. That definitely helps well-being. There's no question physical activity helps well-being. Valuing your relationships, so having good relationships at work as well. I'm bad at this myself. I have to remind myself when I walk to work, instead of getting right in that, take care of patients, get things done, to say hi to my colleagues, smile, how have you been? How was your Thanksgiving? Like I heard you guys doing. And traffic tips. Well, I think you've beat that already by living here. Phenomenal. I don't even think I have to talk about that, do I? You've won. Yeah, that's the worst part of my life. Okay, but Bob calculated that his new spring-loaded departure pad would save him 5.8 days of commuting over his entire career, right? I wish I had that kind of thing. That would spring. I have to go 35 miles on the 405, which is one of the busiest freeways in the country. It's horrible to work. If you have any tips, tell me afterward. Email hygiene. So this is a time suck. With our smartphones now, checking email all the time. It's recommended that on a work day that you're trying to get things done no more than 3 to 4 times a day to check. Disable auto alert for your emails. I did that on my phone. It's much better. I don't need to hear when I'm getting an email from Nordstrom's about their sale, right? Rapidly dispose of unwanted emails. And anyone heard of unrollme.com? If you have a regular email, like a Yahoo, Gmail, those types of things, you can get all of those spams filtered out of there. And then also you can keep some of them into you can get 10 all in one email a day of things you might want to see, might not want to see, into Unroll Me. It's been very helpful. Only return calls 1 to 2 times a day. And meetings, how many of you have meetings that are time sucks? So if you can alter those so they all have an agenda that you keep to the agenda, minutes come right out, everyone's invested, looks at the minutes, chick, 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 yes, no, they're out. If you have no control over the meeting and it's a terribly run meeting, bring some other things to do while you're there. Okay, the fastest, most time efficient thing is not always the best choice because you also have to maintain quality, right? What price do you have to pay to multitask? You deserve to have your brain in one place, right? So this may get it done, right? This is going to get the baby and the dishes clean, but this is dangerous, man, having knives in there with the baby, and disgusting too, right? So you don't have to do this. So in conclusion, I beg the administration, if there's any administrators here, to spend time and dollars for well-being. That is the way to improve time efficiency, having engaged, happy employees. Burnout, depression, and suicide are real concerns for medical workers. Your own personal wellness, we also probably should have a plan for our own wellness, unless we're blissfully happy already. Plan and time management, and consider some of those other tips I gave you: positive psychology, mindfulness. And if you want any podcasts, I have tons of podcasts. That's what I do most of the time on the 405. Spiritual group, if you have that, or other passions. The Constitution only guarantees you the right to pursue happiness. You have to catch it for yourself. Thank you very much. If you want those videos later on, I can tell you where to look for them, but they're both about